Hi everyone, how are you? This is Ramin Azarm, LCSW, owner and operator of Flex to Success Clinical Rehabilitation Services, and this is a video on hoarding. This is under the umbrella of obsessive compulsive disorder, where I mentioned that there are a bunch of disorders that I'm going to cover under that particular paradigm, and after body dysmorphic disorder, hoarding disorder is the second one. So let's jump right into it. Let's define hoarding disorder. Hoarding is a mental illness which is characterized by persistent difficulty with discarding or parting ways with possessions due to a perceived urge to save all or many accumulated items for as long as possible. Also important to note is that if you're going to be diagnosed with hoarding disorder, there's usually a perceived amount of stress that's associated with discarding any of the items that you accumulate. So there's usually a stress response when you're accumulating the items, and then there's a stress response when you're forced to have to part ways or discard any of the items that you've accumulated. Criteria for hoarding disorder are as follows. Difficulty discarding items is due to a perceived need to save them. Also, there is, like I mentioned before, distress associated with discarding the accumulated items. That could come in many different forms: emotional meltdowns, self-harm, obsessions and compulsions, refusal to complete activities of daily living like hand washing or showering or cooking for yourself or feeding yourself. So this disorder is very complicated, and I'm doing my best to condense it into a short video so that people out there can gain a better understanding of it. But it is a challenge for sure. So the next criteria is difficulty of discarding items leads to cluttered and congested living areas, which eventually become unsafe. So if you're going to be diagnosed with hoarding disorder, what you'll usually see is people hoarding items to the point where it's actually blocking entrances and exits to their home. This creates an unsafe environment. God forbid there was a fire or some type of crisis where you needed to get out quickly. The hoarded items that are in the home would make it very difficult, or sometimes even impossible, for the individual to leave, and could result in injury or death, depending on the emergent crisis situation that happens to be going on, hypothetically. Hoarding, this is just one example of how hoarding disorder can become extremely unsafe for people that are suffering from this illness. The next criteria is hoarding must cause an impairment in social, occupational, or activities of daily living. So the hoarding, in order to be diagnosed with hoarding disorder, the actual hoarding would have to be interfering with your social relationships with family and friends, your occupational functions, like how you perform duties at your job, or activities of daily living, like I said before, showering, cooking for yourself, feeding yourself, changing your clothes. The hoarding would have to interfere with those areas in order to be a proper diagnosis. The next criteria is hoarding cannot be attributable to another medical condition. Sometimes people with traumatic brain injury have a tendency to hold on to accumulated items for an extended period of time, but that's due to their traumatic brain injury and not necessarily because of they have hoarding disorder. Also, it's important to note that aside from traumatic brain injury, if you had like a brain tumor, which was like manually sectioned out of your brain, that could also lead to some certain types of hoarding behaviors, either with animals or with inanimate objects. And again, that should not be a diagnosis of hoarding disorder, the mental illness. That's a product of the surgery that you received. The last criteria is hoarding disorder cannot be attributed to another mental illness. So just for example, schizophrenia. When you're going through a psychotic episode of schizophrenia, you might have a tendency to hold on to items for longer than usual. That's a psychosis component due to your schizophrenia that has nothing to do with actual hoarding disorder. Also, if you have major depressive disorder, sometimes in order to feel secure and comfortable, you might hold on to items for an extended period of time because they make you feel supported or secure. Usually that's temporary. The difference between hoarding disorder and those types of behaviors is that the hoarding disorder is long-standing, which means it goes on for years and years and years and years and doesn't really get better. So that's how you would know the difference. It's, duration basically specifies that, if you have hoarding disorder, you're going to have these things consistently, over time for a long amount of time. That could also happen if you've had a medical condition like a traumatic brain injury or something like that. But if that's in your history, I'm not going to diagnose you with hoarding disorder, especially if you weren't hoarding before you had the traumatic brain injury or the brain surgery. So those are the criteria for hoarding disorder. 2 things to look at as the therapist if you are doing therapy with somebody who is hoarding. You want to assess their level of insight. You want to know, are they aware that the hoarding is problematic? Are they aware that the hoarding is creating interruptions in their daily living activities or interruptions in their social or occupational functioning? How well is the patient aware that these symptoms are starting to create a problem for them? If they are aware of it, that would be either good or fair insight. If they have poor insight, it means that they don't see the hoarding as a problem and they don't think that it's interfering in any areas of functioning when it actually is. So you want to gauge that insight so that you have a starting point with the patient. And then you also want to assess if there's delusions. Delusions, as we know from prior videos, is false beliefs. And, what false beliefs does the person have about the hoarding? Do they think that the hoarding makes them a more intelligent person? Do they think that the hoarding, gives them a superpower? Do they think that the hoarding protects them in some way? Do they think the hoarding, is safe and healthy? Like, what is their concept of the hoarding? What do they see? Do they see it as something that's, false and untrue and creating these positive scenarios for them when it's actually only leading to a lot of negativity? Or do they see the hoarding as a problematic behavior? If they do, then chances are they're not delusional. So you want to assess those 2 things for starting points in therapy. One of the best therapies to use for hoarding is cognitive behavioral therapy. One of the best therapies to use for any of the obsessive compulsive disorders under this umbrella is cognitive behavioral therapy. I constantly use cognitive behavioral therapy. I push that therapy a lot in my videos because it's very effective and it works. You would only medicate somebody with a hoarding disorder if there is an anxiety and depression component along with the hoarding. A lot of times with hoarding disorder, you'll have people who are experiencing anxiety, they're experiencing depression around it. They also have a history of past trauma, which has resulted in the hoarding getting exasperated and worse. So you want to take a look at all those different components, because if you can treat some of the areas around the hoarding, sometimes the hoarding issue might end up either improving or healing itself. You always want to assess like any motivating factors that could be contributing to someone's hoarding behavior so that you can properly treat the patient. So that concludes my video today on hoarding. If you have any questions or comments, please leave them below, and I will see you guys next time for another OCD umbrella related illness. Okay? Take care, everybody. Have a great day. Bye.